Hello and welcome to this panel discussion. This is a breakaway session from the Nutrify C-Suite Summit, which is being held today. And I know that in the main hall we've been discussing about the global nutraceutical market, about the Indian nutraceutical market. And at this panel discussion, we've called this panel discussion today to discuss about responsible nutrition. What does it mean, etc., etc. So at this panel, we have four people from different perspectives to give their views on how this market is going to progress. So let me start with Abhiroop Chatterjee from Cipla Health, Rahul Adokmal from Bharat Serums and Vaccines. Welcome to the panel. Mr. Bharat Zawar from Tablets India, and Mr. Ravi Vaidyanathan from Signutra. So let's go round the table, each of you all telling me what your companies are doing in the nutraceutical space, to know about that. And you said you're new to, the company that you're in is new to the nutraceutical space, as opposed to Tablets India, which has been one of the pioneers in the nutraceutical space and the probiotic space. So what has been your journey? And I know that because you had started so early, you all had to create the pathway to acceptance in the HCP market. So how did you all go about really creating that kind of a sense for a product like a probiotic or like a nutrition product in the doctor's mind?
Yeah, it was tough. When we started, when we ventured into probiotics way back in 1999-2000, at that point of time, probiotics was not what it is today. So we did need to go to doctors and sort of explain to them the entire science behind it, not for 1 month or 2 months. It went on actually for 24 months. It took us almost about 190 doctor group meetings across the country. I don't think so we left any major city out of it, with each seminar having anywhere between 60 to 70 doctors and going up to almost 400, 500 doctors also. This is apart from going to hospitals and conducting continuous medical education there. So when the science was started to gain acceptance, then the doctors wanted to see whether it works. You know, ultimately the taste of the pudding is in eating it and also seeing whether it really gives any benefit, and that comes efficacy. So the fortunately for us, you know, our company had collaborations with the world leading players in probiotics. So we used those collaborations and created or developed a highly efficacious approved probiotic product, which then when it started going to the market, doctors used it and they found it as extremely efficacious. So that led to the efficacy being established also. Further, we continued our thrust on probiotics by also conducting clinical trials, Indian clinical trials. We already had plenty of clinical trials overseas, but then we wanted to conduct them in India, so we conducted almost about 30 odd clinical trials over this long duration of time, and those further gave confidence to doctors to use probiotics for their patients. So today, as I was sharing in the talk, many doctors start treating gut-related issues with probiotics first, and and don't directly go into antibiotics immediately. So if there is an issue which they can't be resolved with probiotics and all that, then they would go for any sort of infection into antibiotics. So that's all. That's all I also hope for, that as time progresses, we must use or enhance the usage of probiotics for any gut-related issue to begin with. And now science is moving on beyond gut. It is going into various other ailments. There is probiotics for women healthcare, there's probiotics for UTI, there are probiotics for several other areas as well. So yeah, the journey has been long. Some of us in this table also has been a part of that journey. Ravi was with us for some time. And so yeah, education was the key.